Hello everyone. Now I'll discuss question of respiratory system. So we are getting a 8-year-old boy brought to the emergency by his mother. 2 weeks ago, he developed low-grade fever followed by persistent cough. He occasionally has severe paroxysms of cough that are precipitated by eating and do not resolve with antitussive medication. And he has extensive subcutaneous emphysema over the anterior chest is noted. What's the most appropriate next step in the management of this patient? Well, the answer A is correct, chest X-ray. Why? Severe coughing paroxysm, what has happened in this patient? It may result in subcutaneous emphysema. But what is this? In this, the air leak from the lungs into the subcutaneous tissues. This is due to high intra-alveolar pressure provoked by the cough. Definitely when the cough is a mechanism, it's a defense mechanism. And in this, a high amount of intra-alveolar pressure is created. And that can lead to some leakage of the air into the subcutaneous tissue also. Well, in the question also, they talk about subcutaneous emphysema. They talked. But my question is, how we really, clinically, we can find out that there is subcutaneous emphysema? Stop the video, write down the answer. The answer is, it is seen as some smooth bulging in the skin. But that is not a specific answer. The answer is, when you palpate the skin, it produces unusual crackling sensation, crepitation of the gas is pushed into the tissues. This crackling sensation is the classical finding in subcutaneous emphysema. By same process, by paroxysm of cough, even pneumothorax can occur. In this, the air enter into the pleural cavity. Okay. In such cases where we have risk of subcutaneous emphysema or pneumothorax, okay, chest X-ray must be obtained. It's the first investigation to be done to rule out pneumothorax also. Well, I have one more question for you. Stop the video, write down the answer. Subcutaneous pneumothorax can occur in pneumonia due to which organism, especially in children. Remember, our patient is of 8 years old. But my question is, which organism causing pneumonia can cause this? Stop the video, write down the answer. The answer is Staphylococcal pneumonia. Staph pneumonia can cause this because in Staphylococcal pneumonia there are small cysts what are known as pneumatocoel. Pneumatocoels are there, which can rupture and lead to this pneumothorax. So this is the X-ray of typically what we saw in subcutaneous emphysema. Let me remove so you can see better. Okay. And this is the pneumothorax. You can see the lung has collapsed. This is the whole air. And there may be some shifting of trachea in advanced cases to other side. And this is the typical pneumatocoels there. Okay, pneumatocoel, this is what I told you, what we see in Staphylococcus pneumonia. Now I have one more question for you. Stop the video, write down the answer. Like this patient come to you. Okay, maybe adult patient also, having this chest X-ray, having fever also. You think this could be a case of tuberculosis. And you start giving following drug, rifampicin, INH, pyrazinamide and ethambutol, or maybe you can add streptomycin. Not a very popular drug nowadays, but some people are still fond of giving streptomycin in actual practice. Now, patient is a case of staphylococcal pneumonia, and you have mistaken as a tuberculosis and giving anti-tubercular drug. What will happen to this patient? Patient condition will improve remain as it is or deteriorate because you are giving wrong treatment, or any of the above can happen. Stop the video, write down the answer. The answer is it will improve because rifampicin is a very good anti-staphylococcal agent also. Similarly, we have a drug called linezolid. It's primarily an anti-staphylococcal agent, but now it's an anti-tubercle drug also. Similarly, amoxiclavulinic acid, which is a very good drug to be used for a case of staph infection. They also have some anti-tubercle activities there. So we got a lot of information about throat culture. It has got no relevance. Okay, pneumothorax should be ruled out first. Infection can be there, but our main problem is to rule out any chest problem. Ear examination could have caused this child condition via oropharyngeal transmission, but still not as important as pneumothorax. CT scan, the head has not much meaning, but it has no CNS problem or no neurological problem. Blood culture, not needed. Throat culture would be the first, even if you have to go for two, because throat culture or blood culture are, but at least not as important as a case of chest X-ray. The golden line to remember, in patient with apparent subcutaneous emphysema second to severe coughing, chest X-ray must be obtained first to be ruled out pneumothorax. Okay, because pneumothorax causes lung collapse. Thank you very much.